The Thurso and Wick Trade Union Council, along with the Community Council and concerned residents, have been vocal in opposing the plans to close the Accident and Emergency Unit and Respite Bed Facility at Dunbar Hospital located in Thurso. The Trade Union Council believe this is one step too far, and you will now hear from retired Dr Page, who previously worked at Dunbar Hospital, and the Secretary of the Trade Union Council, John Deacon, who along with John Crowden will outline their feelings on why removal of this service will have a knock-on effect within the West Caithness community.
I'm Dr Anthony Page, a retired GP, Chairman of Crossroads Caring, Caithness, Deputy Chairman of Caithness Community Care Forum. I'm going to talk about a letter that I sent on July the 24th to Mrs. Pauline Craw, the West Caithness Reference Group, to which I have not yet had a reply, concerning the future uses of the Dunbar Hospital. I have been planning to raise the issue of not running the PCEC, that is the minor injuries emergency service they have, 24 hours a day. I hope to do so in the presence of a representative of our ambulance service and to hear their comments, but no one from that service has been at the public meetings so far, so I am writing directly to you. I feel well placed to comment on the hospital from many directions, having worked there by day and night as a GP, having been an inpatient on 2 occasions, and used the X-ray, physiotherapy, occupational therapy, and outpatients departments myself. I found the standard of care to be excellent throughout. It would be a great mistake to shut the PCEC by night. It is an accessible and valuable resource for all those living in West Caithness. To shut it by night would lead almost certainly to an escalation of people calling ambulances in order to get to the A&E at Wick, which is approximately 25 miles away. So unless an enhanced ambulance service was able to be put in place straight away, which would be very expensive and probably not possible, it would be a very false economy. On another matter, the palliative care bed is a very important resource which should be maintained. It is a peaceful, dignified and very convenient place for friends and relations to be with their loved ones at that time. The nursing care is calm, experienced and very competent in this role. I feel it would be very short-sighted to remove both these facilities or indeed modify them from what is presently the case. And a final paragraph. I shall look forward to hearing from you by letter or at the meeting on August the 10th at the Pentland Hotel. I am happy for you to share the contents of this letter with other members of the group and other services. That was the letter, carefully written, but no reply to date.
My name is John Deacon, Branch Secretary of Unite Union at Dunbar Decommissioning Centre and Secretary of the Thurso and Wick Trade Union Council. The Trade Union Council in Caithness is a community-based organisation, and along with our community councillors and members of the other organisations, like the previous speaker Dr Page, we have opposed the planned cuts to the frontline services at Dunbar Hospital. This has been done by lobbying our elected representatives in both Houses of Parliament. We also participate in the West Caithness Redesign Group, who are appointed health service professionals attempting to justify why the service should be cut back. In these difficult times and with an ageing population, we should be protecting the Accident Emergency Unit and the respite care provided at the hospital. With the rundown of work at Dunbar and the potential loss of 2,000 jobs, we are at present trying to attract new investment to the far north. Out with the Thurso area, the nearest hospital is Caithness General in Wick, over 20 miles away, and with weather conditions, rural transport, state of the roads etc., the time to get to hospital or visiting families could be an issue. As someone who has benefited from the excellent care received from the highly trained frontline staff at Dunbar Hospital, The closure of this facility would have a major effect in the Caithness West area. As well as the job losses at Dunbar if downgrading occurs, we in the TUC believe that removing one of our jewels in the crown will provide a second-rate health service provision to the young and elderly, and instead of providing a health service free at the point of need, the private sector will step in and provide care for the elderly, dependent on the size of your bank book or the size of your house. The health service was not designed to operate like this, and as trade unionists we should oppose these draconian cuts.
John Crowden, trade union member from Unite, worked with Rolls-Royce, Caithness, and been an active member of the Trades Union Council for many years. We have many problems from our location in Caithness, being rural and remote. We are 100 and odd miles away from a major central hospital that can do x-rays or do scans, etc. Our next nearest major or large hospital is 20 odd miles away in Wick, and now the local health council, or the NHS Trust I should say, are actually trying to downgrade and close our local hospital, which provides us with palliative care and accident and emergency or small injury unit and such like. They came out and said first that it was an improvement in service, they were going to improve what they were trying to do, but the more information that we get, the more we hear from them, the more it sounds like it's solely a cost-cutting exercise. It is to save money, and in these hard times we can understand the need to cut money. But what they don't seem to take into account is the actual service that is provided and how the people who get it actually benefit from it. That so far we've asked questions of the NHS and they've never come back with satisfactory answers about how they're going to follow up or change these services, what we're going to get in place of what they're going to take away. We have rough, vague ideas of, oh, we're going to do this or do that, but they don't seem to admit that what they propose to do is just moving the cost to other areas of government. They'll make the local council pay for extra care homes or care beds. They're going to make the ambulance service pick up extra costs transporting patients 20 odd miles across the Wick for minor injuries, things that could have been attended to locally, and they just don't seem to listen as such. Their consultation so far has been open-ended. There's been very little information, real hard fact. It's all been very vague and generalisations. What our fear is, from a user's point of view, is very much a case that they have made their mind up and they're going to string us along until it comes to the official consultation, then turn around and say, oh, but you've all had a chance to speak and you're not going to get it. They don't seem to. It seems to be the more people we speak to, the professionals at the front line actually delivering the service, the people, the GPs and such like the service that they have. They endorse what has been done at the moment and have grave concerns about what they are proposing. The only people supporting the changes is the actual management, the ones that look after the budget, the ones that sit around in offices and make decisions and policy and such like. And there seems to be a very big disparity between the front line and the actual behind the scenes, the management. And that's one thing I think is, from a local point of view, that we'd like to see is the management becoming more open to what actually is needed by the people that actually use the service.